Female sexual dysfunction covers an array of issues. You can have dyspareunia, which is painful intercourse, anorgasmia, which is a loss of orgasm or never being able to have an orgasm. We've got vaginismus, where actually the muscles around the entrance to the vagina clamp up and means that penetration is nigh on impossible or very, very sore. And of course then we've got things like disorder of desire, loss of arousal. We've got hyposexual disorder, which is where you just have no desire whatsoever, or hyper, where perhaps you're wanting more sex than your perhaps partner wants. And sometimes, of course, we also come across women who have got some form of inhibition around sex. It's not uncommon for women to have any form of sexual dysfunction, and of course we've got to take into account all sorts of life stages in this as well. You know, it could well be that they've just had a baby. They may think of themselves more of a mom now rather than a partner. And later on in life, of course, women can suffer through the menopause. I think a lot of women actually sort of have been given all sorts of strange messages perhaps, or mixed messages about what it is to be a woman and what it is to be a sexual woman. And so perhaps what we'll do is we'll look at their attitudes, what they learnt about sex, where they learnt about sex, how they learnt about sex, and all of these things can actually contribute to how they then behave or feel about themselves as sexual beings. When women come in and report a loss of desire, which is quite a common problem for a lot of women, we have to make sure that it's sort of not got its roots in any kind of medical place, and once we've done that, we look around and see what the psychological issues may be. Now, it could well be that they're having one or two other problems with their partner and they're not able to talk about it, and then it might also be something about looking at how they feel about themselves and their body, so exploring those issues. It is beneficial to come along and talk to a therapist, because actually if it's distressing for you, then it's something that you need to address on your own behalf. And of course you might feel much better about yourself as a sexual being and as a woman if you actually can address the difficulties that you're experiencing.
For more information, visit www.nhs.uk.